City of Stevens Point Police and Fire Commission meeting, recorded, October 6, 2020.
Stevens Point Police and Fire Commission. Leanne, would you kindly take the roll?
Carlson,
Yes. Here.
Persling,
Here.
Moore,
Here.
Ostrowski,
Here.
and Westbeck.
Present. Item number 2 will be the approval of the minutes. Members of the commission, you have the minutes from our meeting on Tuesday, September the 1st. Leanne, you've done a nice job putting them together. I have no suggested editorial modifications. Commissioners, what are you thinking?
I move to accept the minutes.
Motion from Commissioner Carlson, seconded by.
Second.
All right, we're going to give that one to Commissioner Moore. He had his hand up before the others of you were speaking. All in favor of adopting the minutes as presented, please say aye.
I've got my hand.
Aye.
Aye.
Minutes are adopted. Thank you, Commissioners. Item number 3, the confirmation of bills. Commissioners, you received the bills from Leanne earlier. Robert, we'll start with you because I know you have a passion for the finances here.
I really had no questions. I momentarily forgot that the budget ones are a month behind. When I added it up, everything comes out fine, and I had no questions. And I wanted to say that we're, according to the budget, percentage-wise, we're running good.
Are there any?
There's a few items that are way over budget, but again, that's IT and stuff like that, which you cannot control.
Are there any questions? I did not have any questions on any of the bills either. Are there any questions on the bill? Jerry?
Nope.
Ron? Joe?
No questions.
All right. Chief
Zenner
Zenner
has a question.
Yeah, go ahead.
Or
I
wants
just
to
was
say
going to
something.
address the camera equipment. We're over budget on that. We did anticipate that. This is our first year with that budget line for body cams, and we've had quite a few issues with it. We did some significant research on whether to go to a cloud-based. Essentially, that would give us the ability to have a warranty plan automatically with the budget line. It really wasn't worth it, so we're just gonna, our proposal for next year is to raise that budget line to 8,000. But we did anticipate going over, and we're pilfering some money from a SWAT and a range supply budget line.
I had a question for both Chief Zenner and Chief Finn. Ballparking for the commission as of this date, October the 6th, how are those overtime budgets, which you have both at least alerted the commission are over? How are they looking as of this date? Tom, you want to go first since you're up on the screen here?
Yeah, we were looking, I was thinking at the beginning of the year that was going to look good, but unfortunately with the protests that we've had, and we've had some consistent issues, I believe we will stay within budget, but we're not going to have the surplus that we were anticipating earlier in the year.
Chief Finn?
We're over budget on the fire side. We're real close on the ambulance side. We've had a guy deployed to the National Guard since March. He's in charge of doing all this the setups for the drive-up settings for the National Guards. We're working with Comptroller Laddick. We figured out his overtime, and we're seeing if it's reimbursable under the CARES Act, because he's deployed specifically for COVID-19. And then if we get reimbursed under the CARES Act, we should be okay.
All right. I might have missed it because I was looking at another screen here. Did you have an approximate amount, or you still calculating?
Well, on the fire side, we're about we're at about 100%, and the ambulance
Okay.
about 75%.
Okay. All right. Well, keep us posted. You've done a good job with that. Do any commissioners have any questions of the bills we have? If not, I'll entertain a motion.
I move to accept both sets of bills.
Seconded by Commissioner Kirschling. Thank you. All in favor of accepting? Bob, were you trying to get the floor here?
Just before you go to the next item, I'm sorry.
Oh, okay. All in favor of accepting the bills as presented to the commission, please say aye.
Aye.
Opposed, say no. Motion carries. Item number 4 is our monthly comprehensive update on COVID-19.
Chief Finn.
Yeah, thank you. And
Would
go
it
ahead, Bob.
be possible to move Fire Marshal Egan's presentation, I think it's number 12, to number 4? He has a meeting with a developer and he's late for it. We rearrange the agenda, please.
Well, with the consent of the agenda, let's move the fire marshal's presentation on the Fire Prevention Week presentation. Concurrence from my colleagues. Okay, Fire Marshal Egan, we will go to item number 10, which is Fire Prevention Week, which is with us. Go ahead, Chief Egan.
Thank you, commissioners, for moving me up ahead. So we are right in the middle of Fire Prevention Week. Traditionally runs this year, October 4th through the 10th. The significance of that is it's always centered over the week that runs of October 9th to commemorate the Great Chicago Fire that happened October 9th, 1871. So Fire Prevention Week has been going since about the 20s. Currently, it's kind of run by the National Fire Protection Association, so the NFPA. That's where we get our fire codes from. Basically, they're the giant think tank of how to stay fire safe, among many other things. We've been taking place in Fire Prevention Week long before my time, but obviously this year is a little bit different. Generally, we've had hundreds of students come from all grade levels to the fire station, do tours, check out fire trucks, ambulances, show our gear off, basically make our presence known with these students and show that we're just normal people. We're not to be afraid of. They can come to us for help. We've really missed out this year having that direct contact, but obviously that's not a safe environment and we have to protect ourselves at the fire department so we can keep serving people. So this year we've gone completely online with our presentation. So we have set up probably over 20 Facebook posts that are going out, both with kind of canned statements from the NFPA and also both local statements that Shane Westfall, who's a firefighter paramedic here, and I wouldn't be able to do any of this without him, have set up. So some of our more local statements are focusing on our excellent smoke detector installation program that we have here at the fire department. We are still installing those with the proper PPE. And we've also reached out to all of the school teachers that have wanted the programs and sent them out with probably the hardest thing we worked on with our YouTube videos. So those have also been loaded up onto our Facebook page, but Shane and I and Sarah with the city was a huge help in filming basically the same presentations that we did with the students in person. We've now just put those in a digital format, so they're getting the same exact material that we've had success with in the past. But the Facebook posts so far have blown me away. This year, from Facebook's metrics, we've reached just, in the first few days of Fire Prevention Week, on Facebook, we reached over 7,410 individual people with a fire safety message. So we've doubled the amount of people that we reached in the entire year with a normal curriculum. Last year, we reached about 3,900 people with a fire safety message. So we're going to continue doing this in the future. Hopefully, when we go back to normal, we can start getting more in-person contacts again, but we're definitely going to keep this online digital format. It's done better than Shane and I ever could have thought of. So we'll definitely be sticking with at least some kind of an offering online. We've just reached so many people. And then just to finish up the theme this year is serve up fire safety in the kitchen. Every Fire Prevention Week has a theme. So this year it's more important than ever because people are home cooking home meals more than they have in the past. Nobody's really going out to eat as much as they did. So our kitchens are getting more use, and we've had over 15 cooking related incidents in the city so far, which is up from normal for us.
Well, Drew, I was going to ask you, where do most home fires begin? But I think you've answered that for us. So the reaction has been extremely gratifying with your social media posting.
Thank you very much.
All right, questions from the commission?
No, good report.
Yeah.
All right, I don't think we need any formal action. Drew, we'll let you get back to work, and thank you for taking a few minutes out of your business day to provide us with that news, and keep us posted on the number of unique contacts that you're making on Facebook there, would you?
Well, thank you, commissioners.
You're welcome, sir. Thank you. All right, we will return now to the agenda. Item 4, the COVID-19 update from our police and fire departments. You'll notice, commissioners, there's also an A and a B under that. Self-explanatory. We'll go to those after we hear the updates from Chief Finn and Chief Zenner. I think it is important to note, those of you who have known me most of my career know I'm not an alarmist, but I am troubled when I read yesterday that the state of Wisconsin realized the 3rd highest number of new COVID cases in the entire nation yesterday. Well, the state of Wisconsin certainly does not have the 3rd largest population of the state in the United States. This is a very serious pandemic, and we appreciate the work that our firefighters, paramedics, police officers are doing to protect the community. And we're going to begin with Chief Finn. I will stop talking and listen to your portion of the update, sir.
You gotta unmute, Bob.
Bob, you're going to need, there we go.
Sorry about that. We had a little technical difficulties. This wasn't the way that we were supposed to be doing the meeting today, but I'm going to turn over to COVID discussions, Chief Gemza. As in previous updates, as you guys know, I got to commend Chief Gemza for the long hours that he's been putting in and working with all our partners, and that goes with A and B. So I'll turn it over to him for the updates.
Okay, Chief Gemza.
Thank you very much. So briefly, just a quick update. Again, if anybody is interested or needs to know real-time information, please go to the Portage County website under the COVID dashboard. Also, the other one thing I would like to also mention, if you are worried about UWSP, they also have a COVID-19 dashboard. Those are all really good community sources to find out what's going on. Briefly, or sadly, to note that I just got done having a conversation with Gary Garski. There's been 12 deaths reported in Portage County due to COVID-19. The dashboard says 9. There's been more confirmed today, and that will be update. As of right now, you know, today is Tuesday. The county is performing testing, free testing to the public. Just remember to get onto the Department of Health's website and sign up and register for the testing. I just left there. We helped set up. We've been working with Portage County Health Department in PPE and ensuring that we have testing. Stevens Point Fire Department, Amherst Ambulance, and Plover have all dedicated some personnel, which we'll get to with the MOU, to help with the actual testing at the ADRC on Lincoln Street. And they're coming through and they're getting tested, and the medics are helping them. So we're doing our part to the community to try and to make sure that we could pass the word. A briefing real quick, PPE, as of right now, we're doing okay. And again, that's a good thing to hear from me. That doesn't mean we're out of the woods. We anticipate this to be a long, drawn out process with COVID-19. We don't expect anything major to break anytime soon. So we continue to work in finding better ways to decontaminate our ambulance, for which we have. We've purchased 3 different cleaning utensils. They're all atomized, and they're also electrified. The cleaning agent. So what they do is they wrap around the entire object that they're cleaning, as opposed to just being on the surface. That's cut our cleaning down in half based on for deconning ambulances. So those are really good things that we're moving forward with. We're also looking at a couple different other things. We've changed the way we deploy ambulances based on non-emergence. As of right now, I believe there are 8 CBRFs who have COVID-19 positive results in their residence. So with that, we have changed the way we respond. If a non-emergent comes in for a COVID positive patient, we've taken our 2 backup ambulances, we've taken the stuff and we've moved them into cabinets, and they're still on the ambulance, but out of the way so that if they need to be deconned, they're not absorbing any of the virus. And then therefore the frontline ambulance is still available at that point. So they'll take that non-emergent, they'll come back, the crew will help decon it, and the medic one will still be available at that point. Just a quick UWSP update. As of right now, they have a 96% room opening at this point. What they're finding is most of the students that have tested positive are going home to their local communities. So as of right now, they're not experiencing any major issues regarding housing or quarantine patients. They are currently doing antigen testing Monday through Friday. Their goal is 200 students a day. And if you're not familiar with the antigen testing, if they test positive, that's when they would then give them a COVID test after that. They are looking at this point to expand that testing to other student groups, if that's at least positive, and the athletes are also being tested at that point. So again, if you are interested, by all means, please take a look at the UWSP dashboard. They do a really nice job of keeping people updated. St. Michael's Hospital, had a conversation with St. Michael's today. They have 14 positive cases on their floors that they're quarantining and that they're treating. They are not at capacity yet, but they are very close. They are doing a lot of emergency room testing, and they're also doing urgent care testing. I was also informed that Fox Valley is at 100%. Fox Valley Ascension hospitals are at 100% capacity right now. We've had a really good communications between Aspirus and St. Michael's about what might be needed and how we can help them. And the other issue that we're working on currently is the relationships with the assisted livings, long-term care centers, and the nursing homes. As of right now, Portage County Healthcare has, I believe, 4 positive cases, and they are currently able to take new residents in at that point. Remember that they presented with a COVID wing, where they could quarantine off of the normal floor. It's my understanding Stevens Point Care Center, though, has a few more cases and cannot take new patients. What that means to the community is that if grandma or grandpa, or if somebody who needs a long-term care or a nursing home needs to go in there, they're not accepting them. So not only is it just COVID, as it is long-term care that we have to take into consideration when we look at that. That's what I have right now for the facilities and where we're at. Are there any specific questions that you may want?
I'm going to go first, Chief Zenner, then we're going to come to you, then we'll go to the rest of the commissioners. Joseph, you talked about Ascension. I noticed in Aspirus announcing yesterday they're now using overflow facilities as they close in on capacity. You talked about capacity in the Fox Valley, Stevens Point close. What's the game plan when these hospitals in our region reach capacity? What happens?
Well, at that point, we bring in the HERC, which is a regional hospital system, we're in the northern region, and those hospitals work together to find the different, who has bed availabilities and how to treat with those patients. And the hospitals have direct contact with each other through the state website, and they work together to plan the rooms and how they may or may not be able to accommodate each other.
And Joe, could I ask a question as well?
Sure.
Yeah, go ahead, Ron.
I'm just wondering, those people that are here in Stevens Point and Fox Valley that are hospitalized, are they hospitalized because they need to be on respirators, or what's the difference from people self-quarantining at home and the people going into the hospital?
It would most likely be due to needing IV medications and being monitored. The treatment for being on a ventilator now, based on early on, remember when New York was short ventilators, actually the the new treatment now is they're trying to keep them on very high flow oxygen, as opposed to actually intubating them. They found that patients are doing better. So these people are they're quarantined in in the hospitals, but they have special needs regarding their medical care that can't be done at home.
Okay, thank you.
Joe, a question for me.
Yeah, go ahead, Bob. Go ahead, Bob.
My question for me, Joe, is you said we're up to 12 deaths. Is there a age bracket that we're hitting, or are we spread across the board?
You know, that's a great question, Commissioner. I do not know, and I can reach out to the Health and Human Services and find out. But I do know that the age group that is testing positive the most is the 20 to 29 age group.
Okay. What is the,
As far as testing positive, there's nobody closer. There's no age group closer.
okay, and what is the typical recovery time for people in that bracket? 2 weeks?
It really depends. As much as I'd like to tell you that there was a canned answer, it really depends on your core mobilities, if you have any past medical history. And again, remember, we're starting to find that with COVID-19 that it's not, you're just done, you're not, and your symptoms are kind of over with, and that you're no longer contagious, that we're finding that there's long-term health effects to contracting COVID-19, which is something that we all need to be aware of. Again, this is a new virus. This is why it's called COVID-19. We're learning things daily, and you know, like we talk at the fire department, just remember what I told you now might change by noon, you know, because we're learning stuff every day, and we got to stay very flexible.
My last question for you is, Joe, I'm hearing all this about testing. What is it? If you're tested on Monday, can you get it on Tuesday? I mean, the test is really only good for the moment you're taking the test. Is that not true?
Well, yeah, to a certain extent, I understand what you're saying. Yes, if you go get tested Monday and Tuesday you go out and about and do your business and you don't wait for your results and you don't know, yes, you can contract it on Tuesday. You are correct. But remember, we're responsible. We're a community here. We're responsible for each other. And we have to be aware of that with the testing, that, you know, you don't just go get tested and then go back out and do what you have to do. You need to make sure that you stay at least self-quarantined until you get the results to find out where you're at. The biggest thing I can tell you right now is that as the Stevens Point community, Portage County community, we need to act responsibly for each other. And that's what we're here for. That's what we need to make sure that we pass that message out.
Joe, what is the current thinking on, and kind of dovetailing on what Commissioner Struski was asking, what is the current thinking in the medical community as to, before a person tests positive, where they may be able to have the disease and pass it?
That is a great question. So they're really asking for 3 days for the virus load is what they're talking about. So what they want to do is either the signs and symptoms are available. So you're having a fever or cough, or you're starting to have signs and symptoms, or if you've been exposed for 3 days, because what that does, and when I call viral load, that means that your body is now being, the virus is there. It's easier to be detected through the testing.
Okay, Joe, I have a question now, and I understand HIPAA and I'm well aware of it and everything else. But with 12 deaths, is there, you know, I don't want to create, there's a fear, you feel it when you go into a store or wherever. Mm-hmm. Is there something that can be put out that explains, about the 12 people, you know, general things to, you know, I don't know. I'm just looking for some way to calm the public that we can understand a little bit more detail, not names or anything, but how old the person was, did they have diabetes, or I don't know. I'm just trying to think of other things, some more information, because I mean, there's numbers and the numbers are there every day and I see those, but I don't see the story behind the numbers.
No, I understand. And unfortunately, I'm not given those names, nor am I aware of every single person who has passed because of COVID-19 in Portage County. But I can tell you that if we stop the spread at the source, which is what we say, you wear a mask, we can really cut down on these deaths, and we can cut down on the people being sick and the comorbidities of the people. And again, that's when I talk about being responsible to your community and to the people you live with. Again, It's very patriotic to wear a mask as far as I'm concerned, right? I mean, we do not want, if I'm contagious, I do not want to go out and spread that to my loved ones or anybody else.
Well, if you're contagious, don't you have to quarantine by the law?
Pardon me?
If you're contagious, if you have a positive test, aren't you required to quarantine, Joe?
You are, yes.
Okay. Talk a little bit, if you would, about how the cold and flu season factor into this going into the fall too.
Well, again, as we know, as the weather starts to cool, we as I guess human beings, we stop being outside as much as we normally do. We come inside because it's warm. We know this is the biggest spread of the flu season. This is nothing new or exciting. So if you take the flu and then you take COVID-19 and you put those two together, again, this will be our first time running through this, but our anticipation is that this could be devastating. And again, it's really going to depend on how we operate as people. Are we going to wash our hands? Are we going to social distance? Are we not going to expose people when we're sick just because we can? Does that make sense?
Mm-hmm. It does. Other questions for Chief Gemza? Stand by. If there are none, let's ask Chief Zenner to join the conversation from the police department point of view. Tom, these are vulnerable times. How are we doing?
Well, and I actually have Lieutenant Mueller in the office here. He is pretty much running point when it comes to anything on COVID. At the department, just checked with them. PPE, we're doing great. We've been operating standard protocol for the past few months. I would say one thing that's changed a bit, we're becoming more and more fluent in the flow chart of whether you come to work or not come to work. And that's a flow chart that the city puts in. So we've taken some hits at the PD on that. But about the only difference we're seeing also slowly, our auxiliary force is coming out of hibernation. We're going to have a team out this weekend. I believe that'll be our first auxiliary deployment probably since March.
Where will they be deployed?
We have a car show actually in the Shopko parking lot. It's a Tesla car show, and we will have two of our auxiliary down there monitoring. It's outside, so obviously social distancing, and I feel a little bit more comfortable bringing our auxiliary out in an outside environment, not an inside environment.
And they'll be fully masked and other precautions taken?
Yes.
All right. Any questions for Tom before I keep moving forward?
Tom, when you use auxiliary, are you asking for the younger members, or is it a volunteer basis, or what?
It's a volunteer based, anyone that we needed to, and the first two that sign up, they are out there. Like I said, they'll have the proper masks, and Lieutenant Mueller, who, as I said, is our expert on COVID at the police department, also heads our auxiliary unit. So as I'm talking to him right now, I'm sure he'll make sure that they are taken care of and well prepared.
Thank you.
Tom, I have a question.
Go ahead, Ron. Go ahead, Ron.
I'm just curious. I saw some that where you're staggering your shifts, the work shifts. Can you talk about that?
Yeah, normally our patrol shifts, 6 to 6 is the basic breakdown. It's a 12-hour shift. And we also had officers that came in early, and basically that was to cover shift change. So we'd have extra officers in there. What we have done is they're all scheduled now. We have one shift leaving at 5:30, and they go to a break into the patrol room area, in the shift that's coming in at 6. They're not coming in early. They go to the shift brief. So there's no intermingling between shifts. The shift supervisors would be the only ones that would be meeting each other. And obviously that's just to pass information on, but that's the staggered shift. It's no longer overlapping.
Okay, thank you.
All right, Commission, as we are having our update on COVID-19, the governor and state health officials at this time are also announcing new orders for the state of Wisconsin as we're speaking. Chief Gemza, Chief Finn, do you have any advance word on that? Chief
No,
Gemza's going.
we've not received anything yet. We've been watching.
All right. Okay.
I think what I read, Gary, or President, is Governor Evers is going to limit capacity in bars and restaurants and stores to 25%. That was at 1:29 p.m. today.
Yeah, that's what I was just looking on my other machine here. They've announced that businesses, indoor public gatherings will be limited to 25% under the new emergency order. I believe if I'm reading this order correctly, I'd like a little bit more time. It looks like churches are going to be exempt, but okay, we'll keep looking at it. All right, are there other questions for Chief Gemza or Chief Zenner here? Okay, we'll move to 4A. Chief Finn can join us. That is a discussion with possible action pending a memorandum of understanding with Portage County for extended COVID testing. We had hoped to have this MOU by today, but Chief Finn was upfront and said he may not have it in time for Tuesday. I said, well, why don't you, Chief Finn, report to the commission on the extended COVID testing program? And then I will ask the commission to authorize in advance that the president be authorized to execute the memorandum of understanding when the county actually delivers it to us. Bob?
Thank you, sir. Again, I'm going to start and then turn this over to Chief Gemza. He's been working diligently with the county for expanded testing at and he talked briefly about it at the ADRC, the Lincoln Center. What I'm asking the commission to do is give the president of the Police and Fire Commission authorization to sign the MOU when we receive it. I've already talked to Comptroller Laddick about this because this is outside the preview of the contract. So this would be, the county would be paying us in addition outside the contract to cover the costs. And I'll let Chief Gemza explain how it's going to work.
Okay, Joseph, how's it going to work?
Thank you. So what's going to happen is the county they acknowledge that that's outside our original contract with them to provide ambulance services. However, paramedics within the state scope are well equipped to do testing for COVID-19. Working with the health department, an idea was proposed to kind of follow like Sauk counties, where we would help provide mass testing for people, understanding that Ascension, Aspirus, and Marshfield medical centers are at almost full capacity for actual testing. This would give us the opportunity to test more people in the community. The testing days would be Tuesdays and Thursdays. We're working with Plover and Amherst because they wanted to be part of this also, which is a great idea. So every third day we will participate in that. So our day would be Thursday morning when we would participate in the testing. The county acknowledges that they are going to pay us outside of the regular contract, so that there's no hardship to the city regarding the personnel costs, the PPE, and all the equipment that's needed to do that. And that'll be covered under the CARES Act.
So are these off-duty paramedics that are coming in, or are they on duty?
These are off-duty paramedics because you couldn't take two on-duty paramedics who respond to over 10 calls a day to expect to be there from like 1 to 5. You know what I'm saying?
Absolutely. Have they publicly announced the extended testing program, Chief Gemza?
Yes, it is on the Department of Health's website. It is on their Facebook page. We have added it to the Stevens Point Facebook page, and I'm hoping that here shortly I'll be able to get it on the city's website so people can pre-register is really the key to this. So you sign up online, and then when you come in, the testing process is a lot smoother. But we do have people out doing on-site registration if you haven't done it.
And it begins This Thursday or next Tuesday,
But
Chief?
it actually started today. I was just got back before. They started from 1 to 5 today, and we helped set it up.
All right, questions from my colleagues here?
How many people are you testing each day?
The goal right now was to be 150 each day, and that comes through through the state from Exact Sciences. The testing kits were coming from. However, it appeared when I left at 1 o'clock or a little after 1 that reaching 150 today would be no problem. The goal would be 300 a week of test people.
How soon do they get their results back?
As much as I would like to give you an exact date, anybody who's had tested or knows a loved one that has been tested knows that the system is at capacity. The plan would be anywhere between 3 to 6 days. They've been averaging about 3 days on the results. But I don't want to make promises.
Yep.
Are there other questions from the commission on 4A?
Sorry, one more thing. We had asked that they add into the flu shot vaccination, and if there was a COVID-19 vaccination in there too, that's well within the scope of the paramedics. And what I want you to think about is that if we had to do mass vaccinations for our community, if and when the vaccine is released, we want to be on the forefront of helping our community be ready for that.
I'm pretty sure I can speak for my colleagues on this. We concur. The appropriate motion, if there are no other questions from my colleagues, is to authorize the commission president to sign and execute the actual contract when the paperwork is available. I'll entertain such a motion.
I'll make that motion, what you just said.
Thank you, Commissioner Kirschling. Second by Commissioner Carlson. Thank you. Okay, all in favor, please say aye.
Aye.
Opposed, say no. Motion carries. All right, Chief Finn, we'll wait for the paperwork. 4B is a discussion with possible action pending a second memorandum of understanding with University of Wisconsin-Stevens Point for flu vaccinations. You doing this one or Chief Kemza?
Chief Combs is going to finish it up. Once I'll let you know, once we get the MOU from the county and UWSP, it will be sent to the city attorney for approval, and then it will be sent down to President Westcott. The next one is discussion and possible action of MOU with UWSP for flu vaccinations. As it was talked about earlier today by President Westcott and Chief Gemza, the importance of the flu vaccination. There is some talk that the flu vaccination might help reduce some of the symptoms of COVID. I don't know if that's scientists or not, but we are involved with the city where city employees can get them at the firehouse coming up. We isolated one area so we don't have a bunch of people walking through the firehouse. And then with COVID-19, Chief Gems has worked with Karina a lot with UWSP and the students and keeping that line of communications. And they approached us about this, and I'll let Chief Gems go from there.
So that MOU is currently at UW Systems. It's with their lawyers. They're creating the MOU right now. The goal that UWSP had approached us with would be to, on October 20th, 21st, and 22nd, would be to move forward with help with a flu vaccination. Their goal was to get 1,000 of their students vaccinated in those 3 days, which is a hefty goal. They're also going to be partnering with Mid-State Technical College, or at least they're working on partnering with them for their nursing program. And again, this MOU is going to be a little open-ended also, because in the event of another vaccination, they may, for the COVID-19, they may request our assistance also in that. Imagine that we could get over there and help them and do that. So that one, I am not 100% sure how it's going to play out, but I'm fairly confident that with working with Karina and the emergency management at UWSP, that this will work out to both sides.
Okay, are there questions?
They
Go
would be
ahead.
requesting, how many paramedics would they be requesting?
That right now is not clear because of in the planning process right now. They're trying to get we're trying to get a clearer picture of what they need, and that's what we're working on. That's why the MOU is still at the lawyers, so that we can kind of, in the planning phase, I guess the biggest thing we have to understand is things change, expectations change, and we're just trying to think outside the box and try and get them some help.
Well, I commend you because this is looking forward, and it's nice to think that some people are looking forward on this stuff.
Just to be clear, Joe, these are all voluntary vaccinations, correct?
That at the university, yes. I guess all of them would be. I mean, yeah.
Joe,
you got me, Commissioner Moore. You got me. Yes, they're all voluntary.
I'm certainly comfortable with the request, but before we move forward, I want to back up. Joseph, you said something, I'm reviewing my notes on your presentation, and you said, quoting now, a majority of university students who test positive for COVID are going home. Do we have any idea how many students that is?
I do not. I'm confident Reno would know that. I did not ask that question. I just asked her how they were doing, and we were just looking to see what their capacity was, because once you reach capacity, you have to come up with another plan. And so that's what I kind of found out.
So if they test positive in Portage County but go home, where is it counted?
Here.
It would be counted in Portage County, but that would go to their home health system.
Right. Right. Okay. All right. Are there questions on the memorandum of understanding with the university for a flu vaccination? Excuse me. Okay, I'll entertain a motion.
Motion to approve it.
Second by Commissioner Kirschling. Thank you. All in favor, please say aye. Aye.
Aye.
Aye.
All right. Okay, Chief and Chief, well done on the presentations, and we'll stand by for the memorandum of understandings from legal. Item number 5 on our agenda this afternoon is the status of the 2021 capital budgets, which go before the city for final approval. I think Mary Kneebone is still with us, can join us if she wishes here. Chief Finn, why don't you start? What are you hearing? What's the latest on the capital budgets?
The last meeting that the Common Council had, they went over every department's capital budget. As of right now, I do not anticipate any problems with the fire department budget. And we'll see what happens at Monday's committee meetings.
Okay, Chief Zenner.
Well, I know there was some questions that came up at committees concerning our squads, which are on a 3-year rotation. Previously, we're on a 2-year rotation. I think the mayor did a good job of addressing the obvious need of swapping those out, but I know one alder had some questions on that, whether that continues at the next committee meetings. Remains to be seen, but at this point, I don't anticipate any problems with that and our firearms going through.
Okay.
The gas masks got scratched, though, didn't they?
What was that?
Did the gas mask get scratched?
That got basically at the department head level before it went through. That was held out. Obviously, some cuts needed to be made. Understandable, and I believe we're going to attempt to make a purchase for those masks through asset forfeiture funds.
Okay.
Tom, is there sufficient funds to do that, or is it more of a we'll buy some and go for there, buy them piecemeal?
We're good at this point. that issue coming in, we also needed to make a purchase for some SWAT helmets that you most likely will see on the next budget line that comes through. That was a significant expense that also came through asset forfeiture, which does assist us many times with those capital requests. They come up, I don't have the exact cost of the helmets. I was just checking here with Lieutenant Mueller, who's one of our team leaders on SWAT. That was a significant expense. I want to say it was around 20,000. So that also includes communication equipment in the helmet. But we're getting a little off on the capital. Ultimately, yes, that will come through on the asset forfeiture. And from where we're sitting right now, the gas mask should be good.
My other question for you, Tom, is that squad cars, are we running with all of them right now? Weren't some of them damaged or something? I thought I heard.
We had a couple of them that went down. I know one was involved in a pursuit intervention technique, pit maneuver, that ended up going down. I don't believe we've had that one back online yet. They're getting old, and truly, I mean, when an individual looks at a 3-year car, you think of your 3-year-old car sitting in your driveway, and that this is not even remotely equivalent. These vehicles are ran 24/7. About the best you could do is probably multiply that by 4, and we'd be looking at maybe a 12-year car. But as other department heads have said, when these vehicles, some we sell back and try to recoup some money. Some are put into the motor pool for other departments to utilize throughout the city, such as our inspectors. Not one of them wants to get one of our police squads. They're pretty well shot by the time they're walking out of or leaving our department.
And wasn't the plan originally to rotate squads every 2 years?
Yes, actually, we maintained a 2-year rotation. Plus,
But
this
right now
isn't
we're
just
running
coming from the
3 years.
police. Excuse me?
Aren't we running 3 years right now?
We're running a 3-year rotation, and I just want to qualify it. I'm not a mechanic. I know maybe change my oil on how to put air in my tire and stuff like that. This is coming off of recommendations from our streets mechanics, superintendent, Laidlaw, who's spent a lifetime under the hood of a vehicle. They know it much better than me. And that is where these decisions are coming from, that this should be a 2-year rotation. Again, we need to, tighten our belts. It's budgets are tight, and we've gone to a 3-year rotation. But even putting that out 3 years, that now not only affects a capital, but it goes towards our operational. Those vehicles now have more of a repair bill. We really don't want to push that beyond 3 years is tough. 4 years, we're going to have a lot of downtime on vehicles.
Tom, I have a question. I see it's 12 vehicles we're talking about. Those aren't all line vehicles, are they? Are you talking some IB cars here, or?
No, we got the line vehicles, plus we have unmarked squads that, frankly, I believe they're at 6 years, and that's used for our administrative personnel that stay here. Unmarked squads, even though they're, you look at a municipal plate, pretty much they're not an undercover squad, but they're unmarked, and also we use for training. Those get used not as extensively as our line squads, obviously, so they're not on a 2 or 3 year rotation. Plus, we got our K9 vehicles too.
Okay, and just to sound like an old guy here and give you a point of reference, in 1978, when I started, we traded in cars every 6 months. Every 6 months, and we've come a long way, baby. Yeah.
Well, and actually, let me call him Mary Nebo. And Mary, I know you weren't expecting, but you are, of course, the liaison to the Police and Fire Commission from the Common Council. Is there any additional thinking you could provide for us, please?
It seems to me that both police department and fire department have the support of the council. I haven't heard anybody talking much about concerns, but then we don't talk to each other much just because of all the rules. I will certainly be an advocate when it comes to that. I know the cars, you guys have to have new cars. It's just at this point, they're probably not safe. And I know the next couple years, the budgets are going to be shaky. So I think now we got to get them now, or who knows how long it's going to be. So I don't anticipate a lot of pushback on that, but one never knows.
And Alderperson, the timeline is it goes in front of the city this coming Monday. Is that correct?
Yes. Yeah. And then council approval on the third Monday.
Right. And Commissioner Carlson, thank you for making that point on when you started. I remember the years that I worked directly for the city. We were on a 2-year replacement plan, and that seemed, even at the end of 2 years, and that would have been your patrol years, and certainly some of Chief Zenner's younger patrol years, that seems, as Alderperson more likely remembers too, at the end of that 2-year cycle, we were kind of stretching it to that point, weren't we?
Yeah, I agree.
Yeah. All right, and I certainly would concur with you, Alderperson Nebon. I think a key consideration here is safety. I think after 3 years, you're talking a very legitimate safety concern that this commission would have for our officers who use these things, these cars, 365 days of the year. And I think I like the way Chief Zenner characterized it. It's not exactly like this is a car been sitting in your driveway for the last 3 years. These are on the road. They're in office every day of the year. So
in addition, President, with all the equipment in there, all the electronic equipment,
yep,
they're probably running sometimes 24 hours a day. You know, they're not shut down. That engine's working 24 hours a day. And so I think it's unfathomable to think that squad cars can last 4 years.
On top of that, they also, for the majority of the time, are sitting outside. They're not in a garage.
Right.
Those things are taking more deterioration than your personal vehicle will ever take.
Commissioner Moore?
I was going to say that it's not alluding to kind of the same thing Ron was getting to, is that you can't just look at the odometer and go, it's got 100,000 miles on it, because that motor runs, the car may not be moving, but they have to leave the engine on. So it's being used a lot, and the mileage is not a good indicator of how much.
Okay, well, the commission thanks you, Alderperson Nebon, in advance for any advocacy you would have on behalf of the budgets that come from this commission. Thank you.
Mary looks like she's working part-time as an air traffic controller.
Indeed, indeed. In fact, I'm going to have to leave. I have a redevelopment authority meeting at 3 that I serve on that committee, so I have to log off. So this was a timely moment, and I will be supporting both of the police and fire budgets at finance and again at council. So rest assured.
Thank you.
And so to jump into the redevelopment authority, you just push a couple of new buttons, right?
Indeed, yeah, I hope so.
All right, thank you. Is there anything else for Chief Finn or Chief Zenner from the commission on the capital budget update? Thank you, Alderperson Nebon. We appreciate it. All right, let's move to item 6, the annual performance evaluations for the police chief and the fire chief, members of the Police and Fire Commission. As all of you know, Leanne has distributed the evaluation forms to the commissioners. Both Jerry, you received the form as the liaison to police, correct, sir?
For which, I'm sorry, I was.
Just the evaluation form for the police chief's evaluation.
It is available. I haven't printed out my copy yet, but yes.
Okay. And Commissioner Kirschling has stepped aside for a moment, so keep an eye.
I'm still here.
Oh, I thought you had to leave at 3. I'm sorry.
Yeah, I'll be calling in a few minutes, but yes, I did receive the evaluation.
All right, Commissioner, and if you don't want to answer, this is fine. How long do you anticipate you'll be away, sir?
Well, as far as video, I'm gonna be off video, but I'm gonna call in for phone.
All right. We'll look forward to you joining us.
So it'll be simultaneous.
All right, you notice in the information from the city personnel office, commissioners, the deadline from the city for submitting the completed evaluation form will be Friday, December the 4th. So please make note of the December 4th deadline. Commissioners who are liaisons, if you aren't already working with your chief on their evaluations, please commence as soon as possible. Chief Finn, Chief Zenner, if you haven't already started the self-evaluation phase, I would encourage you to do so at your earliest convenience, so that when you meet with your liaisons, you are prepared to have a vigorous discussion on that. The other thing that grew out of our previous for Commissioner Kirschling, Commissioner Moore, and Commissioner Carlson and Ostrowski, if you wish to, I would personally encourage the liaisons to have conversations perhaps a little bit deeper in the organization. We had discussed some type of supplemental review, some type of additional reviews. That option, of course, remains at your disposal. So, Chief, start the self-evaluation. Commissioners, we will discuss very soon when we will hold our commission meeting to review the work done by Commissioner Moore, Commissioner Kirschling, working with their chiefs, and then schedule a second meeting where we will invite the chiefs in for their formal annual evaluation. Are there any questions? All right. With that, any questions, Chief Zenner, Chief Finn?
Nope.
No? Okay. You know, Chief Finn is uncharacteristically quiet today. Have the rest of you noticed that?
No one's complaining though, are they? I'm just kidding, Bob.
All right.
He found his mute button.
Okay, update item number 7 is the update on the police chief search. Commissioner Carlson, you're leading this effort. Would you like to lead us through this discussion, sir?
Well, yeah, it'll just be really quick. I think everybody's got a copy of the two pieces of paper, I guess I'll call them. But we got input from Lisa Yakush, President Westcott, Tom Zenner. Leanne did an extraordinary job of pulling it all together and emailing it out, as well as myself. And if you have any questions, I think it's pretty self-explanatory. I think we're in a weird time. I think there's going to be a lot of competition to fill positions out there. There's been a lot of people leaving police chiefs positions, retiring, being dismissed, whatever. You read it every day. But I think we're ready to go is what my feeling is. Let's get this started. Let's get the ball rolling and go from there.
Commissioner Moore, Commissioner Kirschling, Commissioner Ostrowski, questions, comments for Commissioner Carlson? Bob?
No, I really want to thank for sending those sheets forward. I've read through them twice already. I plan on doing them again. I too think that we owe it to the department to move forward on this.
All right.
And I'm not
I'm
saying,
good.
I just want to say, Tom, looking at you and your little picture there, this is not a testimony about your performance, because I think you've come in as a pinch hitter and you hit the ball out of the ballpark. So this is nothing to take away from all your work, all your effort. It's just, I want to pat you on the back at the same time too.
Thank you. Don't concern yourself on me. We're ready to move forward.
Okay.
Jerry, would you repeat what you said? I didn't hear you.
I said, Tom, make a note of that for your evaluation.
Absolutely. It's recorded.
I did notice Tom's hair is getting grayer.
A little bit right around there,
yeah. What is the new date? I noticed on the police chief description of the job, it says new date. Have we issued a date yet?
No.
Generally, I think the recommended procedure would be to leave it open-ended until we have what is the actual term? Until we as a commission believe we have a sufficient number of qualified candidates.
That's a good word. Yeah.
Yeah, you don't want to say we're going to close this off on such and such, and then we have like one applicant. We don't want to get into the same position the University of Wisconsin system was in, where at the end of their extensive, lengthy search and screen, they had one candidate. We don't do that. Leanne, if you'd be kind enough to turn your microphone on, if the commission gives the green light here today, what happens next? What do you do?
I work with Lisa to get it posted, to get the job posted.
Do we remember? I don't remember where we post this, and I don't want to put you on the, I really don't remember, and maybe you do, and maybe one of my colleagues remembers. How do we spread the word on this? How do we get it out?
Magazines.
Well, I will look back at the 2015 process. I do know that we send it to some of the law enforcement sites, and then Lisa forwards it, and I'm not exactly sure where, but I can find out where she posts it. But I will work with her to get it posted. I'll check with you want me to check with the language if she has ever used like an open-ended application deadline date?
I would think it'd be, I would think it'd be rather boilerplate or, something
Right.
across the board. So yeah, I think that would be a good thing. Check with her. Let's pump that in there. And, whenever, if she could let us know when the posting date would be, that would be great.
Okay, sounds good.
And I can help you.
If my memory serves me right, it was some police organization we posted it with, because that's what took it nationwide.
Yeah,
I just don't remember what organization it was.
Yeah, I don't remember. Chief Zenner, you might be able to help too, working with Leanne to spread the word among chief organizations, associations that you belong to or participate in.
Yes,
Chief
and I was
Flynn,
just making sure we have Commissioner Kirschling back in on phone so everybody knows. I was updating that.
Okay.
I actually am looking, and I have my July 7th from 2015 where we advertised for filing that national.
We can't hear you, Leanne.
Yeah, I really can't.
So it was Wiley Nut, Wisconsin Chiefs of Police Association, National Academy Associates, and in parentheses it says FBI, League of Wisconsin Municipalities, Illinois Association of Chiefs of Police, and Porter County Gazette. That's where we
Yeah, and I tell you what, Leanne, there was a little trouble there. Maybe you could just, at your convenience, tomorrow or Thursday, why don't you just briefly email the commissioners that list of organizations? That'd be a little easier. And if need be, if you or Lisa, I can certainly give you some boilerplate language that we were talking about as far as keeping it open until the commission receives what it believes are an acceptable number of qualified applicants for the position. Because, I mean, I remember, we won't disclose any details, but in our last process, we had folks that applied who had no law enforcement experience at all. I mean, none, never even worked as a police officer. So you have to have qualified applicants for the, and I can certainly provide additional language that we used at the state, if so be necessary. I'm going to move that we formally authorize Lisa and Leanne to get going, get it started, get it posted, and is there a second?
I'll second it.
Okay, so seconded by Commissioner Carlson. All in favor, please say aye. Aye.
Aye.
Okay, you're good to go. Thank you. Thank you, Leanne. We appreciate all your hard work. And Commissioner Carlson, you're going to continue to be busy with this, and we appreciate your work too. Thanks, Ron.
Thank you. Thank everybody.
Yep. All right, number 8, update on police department policies, drug and alcohol-free workplace, policy on discriminatory harassment, policy on standards of conduct, and policy on use of force. These are 4 proposed amendments or modifications to existing policies that exist within the department. Just to set the stage before I turn it over to Chief Zenner, I'm going to leave it up to the discretion of my colleagues. You can either adopt these policies, which you've had for a few days to study today, or we can simply continue our study of these policies if you'd like some more time and do some more homework on them. But I believe both the chief of police and his management team would like us to approve the modifications on the use of force policy today. So with that stage set that way, Chief Zenner, I'll turn it over to you.
Okay, and I've worked with Commissioner Moore on this. I'm going to address first is policy 300. And basically what I did, policy is obviously much bigger than what I'm showing. These are just the particular paragraphs that we are looking to modify. The use of force policy 300 should be the last one in that packet. Very small but important terminology, duty to intercede and report. The last paragraph, I just changed the word should to shall. This is a mandatory reporting situation, and we need to have it identified as such in our policy. This particular policy, I ask that we vote and move forward on today.
And before we go to any other policies and open it up, I think I want to emphasize to my colleagues here that all of these policy modifications have been reviewed in depth by the city attorney, and he has signed off on them. Is that correct, Chief?
Yes.
Okay. All right. Please continue.
Yep. And this particular policy too, it's self-explanatory with things happen nationally. This is just good housekeeping within our policy to update that particular one. Was there any questions on that terminology update?
And Alderman, excuse me, Commissioner Moore.
Old habits die hard.
That is a tough habit to get out of. Commissioner Moore, I want to acknowledge that you work very closely with Chief Zenner, so please feel free to jump in, guide this, steer it any way you want, Jerry.
Well, I don't think it's going to take much guidance. I think Tom did a great job. That it clarifies some things and takes some wording and makes it definite so that it's understandable by everybody involved. It just clears things up. Words matter.
Absolutely. Thank you, Commissioner Moore.
You're welcome.
Chief Zenner, you have the floor. Go ahead.
The next policy updates, and frankly, we've experienced some unfortunate situations locally within the police department, and some concerns that we had moving forward. We wanted to do a scope of our policies to see if we needed any updates. And essentially that is what these updates are: responsibilities within the police department, reporting responsibilities. The first one I would discuss is drug and alcohol free workplace. This is policy 1012 and addresses member responsibilities. Now, to clarify, members within our policy book is identified within the definition of any employee. This is from a community resource officer to the chief of police. And as a member of the police department, what I haven't read on here is the change, and ultimately with this is a change to add a clear understanding of mandatory reporting for violation of this policy. Initially, it stated members shall notify a supervisor immediately if they observe behavior or other evidence that they believe demonstrates that a fellow member poses a risk to the health and safety of a member or others due to drug or alcohol use. And what I added to this policy was a simple line that would also be as if an individual is in violation of this policy. Fairly self-explanatory with the policy, how it was written, but there's no doubt now with that line added in there. It's an individual who's employed at the police department. They have a mandatory responsibility to inform if there's a violation of this policy, a drug and alcohol issue within the police department.
Tom,
Okay, Bob, you go first. Bob, go ahead.
Tom, this does not cover the auxiliary, does it?
They're a member of the police department.
Okay, thank you.
Yep.
Ron?
My question, Tom, was how will this be communicated or instructed to the members of the police department?
Every policy that is updated, it's within the Lexipol system that we have. If there is an update done, it automatically gets kicked out to every employee. They need to read it. They need to manually acknowledge that they've received that policy. And if I have access to go back and check all the policies, if they have not reviewed it, obviously they come up with a flag that they haven't reviewed it yet or acknowledged it. But
Okay.
we'll also have this conversation with each work group lead, and they'll ensure that's taken care of too.
Okay.
If we weren't in the middle of a COVID pandemic, I would have encouraged you to meet with each shift, each officer as possible, but certainly find unique ways to protect yourself, but at the same time, make sure that the urgency of this matter is transmitted to everyone that is involved in our police work. Okay.
Absolutely. And we have met with the lieutenants and had conversations that obviously led to these policy updates, and that message has been transmitted already. The next policy I was going to go over would be policy 328. This is discriminatory harassment. I did not make any change to this particular policy. However, what I did was to separate it. It was a rather lengthy paragraph, and by reviewing it, I thought it would be more obvious by separating that paragraph and what the expectations are within the police department. Now, there was some questions that had come up on this, where members are encouraged to promptly report any discriminatory, retaliatory, or harassing conduct or known violations of this policy to a supervisor. And the questions that I had was, why are we just telling employees that we encourage them? We need to remember that if you are the victim of retaliation or harassment, we can encourage them. We certainly aren't going to punish somebody that has been a victim of harassment to say that they're in violation of a policy. Now, obviously, if that was another individual, that would fall under standards of conduct to report that. But this is within that policy in and of itself, where we're referring to the victim, that they would have to bring that forward.
Chief Zenner, this is an area that, and maybe Commissioner Moore can help too, that I had a question where we say complaints may be filed with the chief of police, comma, the personnel director or the police and fire commission. By the personnel director, I'm concluding that's the city personnel director?
Correct, because
Okay.
we're also, this isn't just sworn personnel. We do have non-sworn personnel within the police department that at this point ultimately come down a separate chain.
The quote, I was curious though, if we needed some qualifying language that if an officer were to go to the city personnel director, that really is outside of the chain of command. That's not the chief, that's not the commission. Do we need to provide some guidance? We have a good personnel director right now and she would know what to do with it. But I'm thinking in the future, would the personnel director go to the mayor? Or would the personnel director know to go to the police and fire commission or to the chief of police? I'm just looking for, should we clarify that so there's never any question about, well, certain officials were aware of something, but nothing happened. Well, they're not necessarily in the chain of command.
I can certainly add some qualifications on that. I know Chief Finn had something he wanted to
add. Chief Finn?
I don't want to throw a monkey wrench into this, but it's my understanding under 6213, the city personnel director has no authority over any of our personnel.
Right.
Your chief, and it goes right to the police and fire commission. You're right. We have a good person, HR personnel and stuff. but when personnel decisions are made in the firehouse, it goes up the chain of command and then to the Police and Fire Commission. That's what I read 6213. I would, and I'm not trying to throw a monkey wrench into it. I'm just giving my opinion.
I like Gary's idea. I think that should be spelled out somehow. That should somebody go that route, that it has to come back to the PFC.
Yeah, and we acknowledge, Chief Zenner appropriately pointed out, as we all know, we have civilian employees. Leanne is a civilian employee. If there's a concern, it's well within her legal right to go to the city personnel director. We have other civilians that work for Leanne, other civilians that are in the, and I think it's important, but I think we need to put some qualifying language in there that if an officer, as Chief Finn and Chief Zenner both said, show up at the personnel director's office, the personnel director's office knows where to send them. So we don't get into this, just to repeat myself, well, you know, the so-and-so was made aware of it, or such and such an officer was made aware of it, but nothing occurred. And then we learn later, well, that's because they aren't really in the chain of command for a police officer. So Tom, I'm going to ask with consent from my colleagues that we put a little qualifying language in there, acknowledging the role of 6213, but maybe providing some future guidance, if you're all comfortable with that.
Well, I have a question now. Let's take it one step further, and I don't want to incorporate all city government, but let's say they don't go to our personnel director, but they go to the mayor or an alder person with their complaint for whatever reason. Should it be more, why are we just limiting it to the personnel director?
You're speaking about an officer, Ron?
An officer or a civilian, whatever. Let's say the report doesn't come through the chain of command of the police department, but somebody says it to the mayor, you know, there's an officer that's doing this or whatever. We should, I just don't want us to limit it just to the personnel director. Shouldn't it be anyone in a position of authority? I don't know. I'm just throwing that out there. It popped into my head because I was reminded of something that occurred.
I would like to put a clarification on this policy. Remember, this, how this is written would be equivalent to a victim of harassment making a report. And like you're saying, Commissioner Carlson, it really, we're certainly not going to punish somebody who's coming forward that says they've been a victim, whoever they go to, even if they, you know, report it to a lieutenant all the way up to the mayor or the PFC. We could certainly break that down into a group, but who they report to, we do have policies where it says we identify, but not just limited to these individuals.
Okay, that's
so it
good.
leaves it very open-ended.
I just want to ensure that it's not kept in the dark, but that it would come back to us.
Well, and you both made really good points here. There are policies that are independent of our policies that the city has as alderperson, former alderperson Moore remembers. So, I mean, Leanne and other civilians are covered by other civilian policies that are through the city personnel committee. Ron has a really good point, though, that, I mean, I think we have to be careful in how we delineate this. I mean, if we now say, well, an officer can go to an alder person or to the mayor, well, they're really in personnel matters a private citizen. You can't do that. I mean, as much as every elected official, including the mayor, the reality is that you need to be sent to the chief of police or to the Police and Fire Commission, who have the authority to investigate, have the authority under state statutes to see what's going on, and then the legal right to do something about it. So, Tom, let's send this back. You and Jerry, see if we can come up with some, see if we can just kind of clarify some of that for us, okay?
Okay.
All right. Would you please continue? Thank you. Go ahead, Tom.
I was just putting some notes down on that one. The next one I have is that same policy. And this might answer some of these questions. Again, that first part was responsibilities of individual. Now we're talking about a supervisor responsibility is the next part of that. And it would be paragraph 328.4.1, supervisor responsibility. We essentially, there was paragraph F, or line F out of that. We made it its own line so it would stand out, and added PFC notification requirement if allegation involves a division chief or higher. Ultimately, that line, if report of an allegation or observation involves the rank of a division chief or above, the chief of police is required to notify the PFC of the complaint no later than the next business day. So ultimately, we can clean up that other one, but it does address it when this comes to a supervisor. It will come to the police and fire. Well, in this case, if it's ranked division chief or above.
Okay. Okay.
Is there any questions on that? And also before that, that paragraph was already in there. The supervisor or manager receives that complaint, they shall notify the chief of police in writing of circumstances surrounding the reported allegation. So we have within this paragraph, essentially, it will get funneled to the chief of police, and if it's a division chief or above, and in our policy, division chief is equivalent to the assistant chief. That will ultimately go directly to the PFC within a day.
Okay.
Any questions on that one?
None at this time.
Okay. And lastly, standards of conduct. We had a change in paragraph B. And ultimately, what initially was listed, supervisor responsibilities, failure to promptly and fully report any known misconduct of a member. Again, member is anyone from chief of police down to auxiliary. Fully report any known misconduct of a member to his or her immediate supervisor, or to document such misconduct appropriately as required by this policy. That was changed to failure to investigate, document, or if necessary, inform the chain of command of any reported misconduct by a member of this, misconduct of a member by this department. Was there any questions on that?
I have none.
Okay.
All right.
Again, I know the one that I was hoping to take forward today was the use of force policy. I think that's important to get that updated within our policy manual as soon as possible. The others we can certainly continue to review. And I see policy 328 we will.
Let me try something here, at least float it to my colleagues. I'm comfortable approving the drug and alcohol-free workplace policy as submitted. We didn't really have any changes for that. We'll send 328 discriminatory harassment back for those updates. The standards of conduct the Chief Center just reviewed, we're comfortable with that. And policy 300, the use of force. I'm willing to move forward and move approval of those three and send policy 328 back for further revision.
I would concur. I would concur.
All right. We have a motion. It has been seconded.
Gary, can I just have a clarity? Which ones are you holding back on?
We're going to hold back on policy 328, Robert. That's the one we were talking about, the personnel director, the role of the police. That would be 328, discriminatory harassment. We need a little more.
Thank you.
Okay, a little more clarifying language. All right, since we are making policy changes, I'm going to have Leanne call the roll. You are voting to approve those three policy amendments as submitted to the commission. And Leanne, would you call the roll?
Carlson,
Yes.
Kirschling,
Yes.
Moore,
Yes.
Ostrowski,
Yes.
and Westcott.
Yes. All right, Chief, you have the approval on 3, and we'll look forward to the revision on 300. Okay.
Okay.
Or 328. All right, next is the police chief's report. Thank you, Commissioner. And Commissioner Moore, thanks for working with the chief on that. Appreciate it. Let's move to the police chief's report for the month of September. You have the chief's report. Leanne has provided it to the commission. Chief, what would you like to highlight for us?
All right, I was looking through it, as I said earlier, well, it shouldn't respond. We have had auxiliary units been suspended. So ultimately their first activation is going to be in next month's report. So I won't follow up on that. We've had some training scheduled that's been canceled, fall in service due to COVID-19. We've canceled that. We look to be bringing that forward in the spring. We had some training involving de-escalation that was going to be scheduled on that. Brian Brooks is our communications instructor, and he's done some significant training on that, but unfortunately we'll have to wait till the spring. We did get a 2-hour online training for de-escalation and intervention completed, and that was, I believe that was through CIVMIC, the city's insurance carrier. SWAT annual qualification was canceled. We will not be making that up. That's annual. Looks like we'll just wait till next year. But for training, we did take some hits on that. Staffing, Cody Stankowski is, I believe, actually scheduled to start his first week of FTO tomorrow. I could be wrong on that one, but I know it's in the next couple days. Zachary Gartman and Kimberly DeRoser, they're in step 3 of the field training program. All is going well with their training. We anticipate that finishing on schedule. Andrew Hensel, he's our new community resource officer. He began employment, and quickly thereafter, Officer CSO Mislowski did resign, so we will be going through another process hiring there. We have had some difficulties hiring CSOs, being part-time. Hopefully we get something that's a little bit more long-term in those positions. We do have one person that's filled that role for quite an extensive period amount of time, but for the remaining positions, we've had some difficulties filling the part-time role. Notes of interest, we had a few cases that were fairly significant. September 5th, officers responded to a call of a male subject holding 2 women hostage with a gun. That was a SWAT call out. Prior to SWAT arrival, the individual did walk out of his residence and was taken into custody with no incident. He was heavily under the influence of methamphetamine. We did have some follow-up contact with him as he continued to have episodes related to meth use. September 14th, fairly significant call there. Began as a vehicle pursuit in Marathon County. They terminated, ended up getting picked up later on by Portage County out on the interstate. This was a rather high-speed chase. Portage County terminated. They found their way into the Stevens Point area. Ended up eluding officers. Kind of note that ended up coming to rest in my front yard, where officers ended up making an arrest of 3 individuals, 1 from Milwaukee, 2 from Wausau. Other than that, I did talk to our drug enforcement officers. I know in the past, in particular, Commissioner Carlson, you wanted me to get more information concerning what they're dealing with. We do see continued trends of an increase in fentanyl within our community, and we did have a significant search warrant within town. 2 individuals were arrested. They're transporting methamphetamine from California. Mental health, we continue to see a spike in this area. Consistent numbers of welfare checks. I think last month we had 51. We're at 50 still. 3 emergency detentions, 5 voluntary commitments, 1 alcohol. In particular, 1 individual, a female, planning an overdose on heroin. She did have small children in her residence. That case, I believe we had Health and Human Services came in and foster care was utilized. We also had a female subject doing taking overdose of pills. I do not have what that medication was, but voluntary commitment was completed. So we continue to deal with extensive mental health calls, and whether there's a correlation with COVID and the situations that we're in, certainly makes sense.
Chief, could I ask you a question?
Yes.
Could you give an update? Is somebody else talking? I'm just curious about the homeless situation. And I guess more specifically, I see every day a 47-year-old man, and I don't know if it's the same one or not, but it seems like it's Groundhog Day every day with this person and others. How's the homeless situation going now?
I know which one you're talking to. It seems like we repeatedly go to one location in town, one of our laundromats. We had 2 individuals, one in particular, the one that you're talking about. Yeah, I think we deal with them 2 or 3 times in a night. They're not allowed at Salvation Army, the warming shelter. They have restrictions of going there. Yeah, it is somewhat like Groundhog's Day. And as law enforcement has many times in the past, we got to figure out something. So writing a citation only goes so far when an individual isn't going to pay the citation anyways. And that individual may have already worn out a welcome on the resources. And we have plethora of resources in Stevens Point. When you have exhausted those resources, yeah, it's I don't have a happy answer, but we find a way to deal with it.
And I guess that's what I wanted others to understand, because we do have resources here, but when they're exhausted, it's the police department that ends up holding the bag and scratching their head what to do. And I just wanted to highlight that a little bit. And then to follow up here, because I am a stat guy, whether it's baseball or football stats, I was going to ask Leanne and you if I could add more to the police department report, the police chief's report. First of all, I've loved what you've done with it. You've expanded it beyond, and I love that because I eat it up with a spoon. But I'm wondering if we could also have on there somewhere the number of calls for service in a month, so people could see just exactly how many calls the police department is responding to. And then another item, I'd like to see traffic accidents. How many traffic accidents were there in Stevens Point? Citations issued specifically for OWI arrests. And then I know it was a topic recently about bike tickets or warnings, and something along those lines. Seeing we're now integrating bikes on public roadways, I want to see how those are working. So those I'm just throwing out as suggestions, and I'm not trying to add work. I'm just I just like to digest this, and I read it over, and I enjoy what you've done with it. I'm just looking to expand it a little.
I would add, with our current records management system, we do have some limitations that we enjoyed in the past. Simple things such as getting calls for service can be a difficult process when previously it was simply look in there, you could have that in about a minute.
Okay. I thought with all this we're paying for IT, this would be a click, click here and a click, click there, but I guess not.
$500,000 for capital next year, and we might be able to get those clicks back. But
let me offer a couple of thoughts on that.
Yes.
First of all, like Commissioner Carlson, I seem to remember there was a time where there was more information of the nature that Ron is talking about in the reports. And I'm scratching my head, and I don't remember why that information, perhaps Commissioner Moore remembers, why that information was filtered out. I think some of it was, as Chief Zenner alluded to, it became rather intensive and time consuming to collate and collect that data. I think what I would like to do, what I'd like to see here is, why don't Chief Zenner, you and Leanne work together and see what additional information in the categories that you've heard from Commissioner Carlson is readily and easily accessible without adding, 8 to 10 hours of work per month to gather this, and just let us know in the near future what additional values would be available to the commission for review. Is that acceptable, Commissioner Carlson?
Yeah, and I'm not trying to add work for Leanne or Tom. I just thought it would be literally just something you could click on and get at a fingertip. But yes, I'd be very acceptable to that. Thank you.
Some of the reports that we're running, we do have ad hoc reports on crashes, OWIs or speeding citations, bikes. Actually, after the last council meeting, there was a discussion I had. That's pretty much coming down to interim assistant chief Bob Cuso keeping a tally, not having an ad hoc report to be able to break those out. Essentially requires us to monitor the shift briefs, and hopefully we don't have that loss between what's getting marked by the lieutenants and then getting tallied by the assistant chief.
It was interesting. I came across the 1965 annual report that I had here at home. Sergeant Huckey had, at the time, wrote, he was the head of traffic bureau, 268 speeding citations and 266 bicycle warning tickets issued. And I thought, boy, that was really timely. As I was going through stuff, just disposing of it, I saw that. So that spurred me on to the rest of it. Thank you, Tom. I'll be quiet.
Yeah, Bob Ostrowski. Go ahead, Commissioner Ostrowski.
Comment on a couple things there. One is, I understand what Ron is asking for, and I think it would help on the bicycle thing, because a lot of people in the community don't believe we're doing anything about it. I know the police are, but I mean, the community doesn't know it. If we have information like that, we can certainly get it out. Second, I'd like to commend again on the expanded. I really eat up this report because it makes me feel like I'm more on top of stuff.
Yes.
My one last remaining thing is, Tom, is I had a call to you the other day. My concern is with, where do you want people to report these scams? As I called you that day, because I had 7 phone calls by the same thing, 4 more after you and I talked. Where does the community turn to? I mean, they're not going to call 911, but yet.
No, we take them at the police department, and ultimately our investigators will funnel that towards there's connections within on the internet that handle those, but they're difficult crimes.
Well, the thing what I'm wondering is, more and more as I get a little more silver hair around the top here, my friends are in the same boat, and they're saying, who do I talk to? I'm getting sick and tired of these things. Or is it legit or isn't it? And, I was confused that day because this thing started to come on as pretty, real. But yet when it happened 7 more times, I'm going, wait a minute, this is not a legitimate thing.
There's nothing online that's going to be taken identifying data that was not initiated by you. That's probably the best advice. You can go on any of those, contact the police department. It is the world we're in as of now, unfortunately.
So it is all right to tell people to call the police department.
Absolutely.
But definitely not to call 911.
Right. Expectations, these calls might come across. We've actually had complaints that come in that say it's the Stevens Point Police Department calling. They have our number. not sure, I'm not an IT guru, but how they're able to get that to show up on a caller ID, it can look pretty legit. But ultimately, if you did not initiate the call and they're looking for data, don't give it out. Clarify. I know, whether it's individuals that, either got a data breach where they get information. There's individuals that scour the obituaries and get information that's pertinent. It's some people are sick. It's an unfortunate situation and what we have to deal with in today's age, but it's there.
All right, I'm going to, if there are no further questions, I'm going to move approval of Chief Zenner's report. Is there a second? Second by Commissioner. All in favor, say aye.
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 Say no. All right, our last public session item is the Fire Chief and EMS report. You have the Chief's report for September. You have Chief Gemsa's EMS report. Trevor Howard is on board and working as our training officer. How's he doing, Chief Finn?
He's doing very well. Just so, don't expect my report to go as long as Chief Zenner's, because it's not.
Can you get just Bob? Can you get just a little closer? You are kind of fading on me here too.
Better?
Yeah, go ahead. Go ahead.
What's not on the report is found out yesterday that we, back in June, we applied for a DNR grant, and we received that yesterday of about $6,200 with a $6,200 match for the city. And we're going to be able to buy Nomex hoods, battery operated chainsaws, and radio communication equipment. We're going to work with Comptroller Laddick to figure out how to pay the city's match part of it. There's a couple different ways we can do it. Also, we had a resignation. Wes Larson resigned. Wes has been on the job about 3 years, I believe. He wanted to always try to be a flight medic. He applied just for the heck of it, and he wound up getting a job offer that he couldn't turn it down. Sorry to see him leave, but he's pursuing one of his dream jobs. So you can never fault a guy for pursuing his dream.
No.
We are in the process of running a promotional process for to establish a list for captains and lieutenants. We run it every 2 years. That process will happen through the month of October and be done probably the first week in November. As President Westcott said, Trevor Howard started as our training officer, and he's got his work cut out for him to bring everything up to speed where we want it. With Target Solutions, our new training program, I will leave it up to the commission, either November or December's meeting. When would you like a presentation on what's he entailed in his new position? We did with the fire marshal, we did the same thing. So would you like it in November or December? And I'll make sure that the training officer has like a 5-10 minute presentation for you. Tell me what month you want it. I don't care.
My recommendation is we take a look at December with the items we've already discussed here today and other items that we are going to discuss in our next item. November could be a very busy month, and including evaluations and budgets. We'll be well down the road in our police chief search. I keep reminding all of my other colleagues that the Police and Fire Commission is a part-time job, although I'm seriously doubting if any of that is relevant anymore. So let's tentatively, if there's concurrence from my colleagues, I'm not seeing.
Well, the nice thing about going to December, Gary, it gives him a little more time on the job.
Yeah, that's what I was thinking, Bob. That's what I was thinking.
Really quickly, just so you're aware, Trevor Howard potentially is going to be at that incident safety officer school in Illinois if COVID allows. And that is from November 30th till December 4th. So he's actually going to be out of the state. He'd be able to actually virtually get in if he needed to, but potentially he's going to be gone at a different training center, getting some other education. And if the class goes over during the middle of the day, potentially he wouldn't be able to get into the meeting.
Well, then maybe January makes more, January makes more sense because he'll have a lot of first. What's that?
I think so too. I think November and December are going to be fairly busy as it is. And maybe January works out the best.
Yeah, and he'll be fresh off this advanced training. I think it's a great idea. Let's pencil in with concurrence from my colleagues. January.
That, or you can give it right now.
All right. Chief, let's go back with the resignation of Wes leaving to be a flight paramedic. And I get it. I mean, I spent years in the Air Force. The love of being in the air is there, and I get wanting to be in the air. Where are we with an eligibility list for new firefighters, sir?
As of right now, we are down 2. We are in the process of running our own test. Just an update, all the work that we did through COVID to get the last 3 hires hired, we just got the list from Chippewa Valley Technical College to do interviews. So we already have 3 people hired and they're just getting caught up. But this was all the work done behind the scenes with Chief Gemza, Chief Moody, Dr. Clark to make sure everyone can meet all the qualifications and they're up and running. And then whenever you would like some of our new personnel to come before you so you can meet them, let me know. I might have them do a little a picture and like a little biograph that we can send you in the next packet so you guys at least can meet and see who we've hired the last 6 people. But we're running, I got off topic, we're running our own test through GeoGov, I believe it's called. And that test will be taking place in 17th of November. I'm sorry, October. I'm sorry. So, and then we'll try to get a new list. Another thing that's pretty significant under the EMS is Jen Weiss came in and did the National Academy of Ambulance Compliance, certified ambulance documentation. It's really helped with our ambulance report writing, and it's going to help with also, if you write a better ambulance report, you're going to be able to write a better fire report. But she came in and did all 3 shifts. We left station 2 out of station 2. We were able to get our a new system up and running so everyone can be COVID compliant. And I think it was very beneficial. My understanding is extremely beneficial to the members of the department to have that her come in and do the training. CAD, they're still they're having stakeholders meeting, and we'll see what happens as we move on with the county. Other than that, you guys have the report. I have nothing spectacular other than the report.
All right, are there questions for Chief Finn from the commission?
I would like to add one thing, I'm sorry. I would really,
Go ahead, Bob.
No, I would like to commend the Fire Prevention Bureau and Public Education guys to get these virtual trainings out during Fire Prevention Week. There's 2 out. They have 2 more done that aren't edited yet. Sarah is working diligently on it. She just doesn't have enough hours to get them done in the city. But you guys talked about thinking outside the box in the next generation. This is what these younger guys are able to do, is to reach out to the community in different ways that, believe me, there's no way I could ever have done it. So I just think they should be commended for their efforts in getting out the word out in the community throughout these trying times. All right, now I'll shut up.
Commissioner Ostrowski.
Yeah, Chief Finn, I see a new ambulance for 2021. Does that put us back on any kind of a schedule, or is that still completely screwed up? And which ambulance would be replaced?
Chief Gemza can answer that because he's been part of it. It does put us on a schedule.
Commissioner Ostrowski, so yes, it does. We've been working with County Garage and the county finance to work towards that. The purchase will go for 2 ambulances, and the criteria on those ambulances are going to be on miles. So the fleet rotation will be through Stevens Point, Amherst, and Plover. So the ambulances where they actually go will be dictated based on miles and wear and tear, and on whether or not they're holding up to their end of the bargain regarding their quality.
So we really, this is not necessarily an ambulance directed to our department. It's an ambulance directed to the county.
This one will be directed to us, and one will be directed to Plover, and that decision was based on miles and miles traveled and the service records. So that's what we've been working on. What we're trying to do is eliminate the political aspect of purchasing ambulances and trying to get back onto if the ambulance is needed, let's get the one that needs to be moved out of circulation.
Okay, but the county, have they got back on a formal schedule?
We're going to see how this process works. They're going to purchase 2, and then if that formal schedule, if this works out, then we will move into a formal schedule. Yes.
Okay, because that really got messed up the last few years.
I would agree, and I think County Garage would agree also that there needs to be a better method of how they're purchasing ambulances, and that's what we're all working at. And I got to say, it's working well.
Thank you, because that was a big concern of mine through the last negotiations.
I would agree with you also.
All right, I'm going to, if there are no further questions for Chief Finn, I will move approval of the fire chief's report, including the EMS report for the month of September. Is there a second? Second by Commissioner Ostrowski. All in favor, please say aye.
Aye.
Okay, Chief Finn, I want you to work closely with Chief Zenner. You need to leave this meeting, be in touch with county DHS and state DHS. The new directives that are coming as we speak from the governor's office. Some will be for both of you. Also, Chief Finn, I'll await the arrival of the formal memorandums of understanding on the expanded COVID testing for Portage County, and let me know, and we get those things executed. So with that, I'm going to move to item 12. Thank you, Chief Zenner, Chief Finn. Thank you for all your work you're doing. I know you've got lots of work to get caught up here this afternoon. Okay, I'm going to formally move consideration of a motion to adjourn into closed session pursuant to section 1985, 1A and F and G of the Wisconsin statutes for the purpose of preliminary consideration of disciplinary matters and charges against specific persons, which if discussed in public would likely have an adverse effect upon the reputation of individuals named in those charges for the purpose of deliberating regarding preliminary matters relating to the disciplinary matter and charges, and conferring with legal counsel who is rendering advice concerning strategy to be adopted by the commission with respect to litigation it may become involved in, including discussion regarding preliminary proceedings relating to a statement of charges against a firefighter employee and release of information pursuant to a public records request. Is there a second?
Second.
Second by Commissioner Kirschling. Again, Commissioner Carlson, you will certainly have to be recusing yourself shortly, but stay with me for a moment. I want to check with legal counsel on something. Leanne, would you kindly call the roll? We are moving into closed session.
Carlson,
Yes.
Kirschling,
Yes.
Moore,
Aye.
Ostrowski,
Yes.
Westcott.
Yes. All right. We can say goodbye to Tom. You hang in there. Leanne, thank you. We'll say goodbye to you.
Videos of these meetings are available for viewing on the city's website, stevenspoint.com/videos.